want to show you how to actually think through using the AI to explain things. And you have to mix it with a few things. Prompting, you got to get the prompt correct, and you also have to prompt plus the psychology, okay? This is where I want you to double down. Prompt plus the psychology. Now, there's many different variations of psychology, right? If you look at Robert Cialdini, there's the art of persuasion. That's a different type of psychology than a Freud. So it just depends, but you don't have to get too detailed. But you also have at your fingertips the ability to use and have psychology baked into the prompts. So let me give you a simple example, and let's just kind of unpack that. Let's just go into ChatGPT. You guys are familiar with ChatGPT. Here's the prompt that I'm starting with. And this is a very basic prompt. If I'm a dentist and I'm helping my patients see the negative side effects of waiting on treatment for restorative work, composites, crowns, specifically for a crown that is an open margin, then what are some negatives I can point out to them? Now, this is nothing new. You guys know these negatives. You probably could have written this piece on ChatGPT, being super successful clinicians as you all are, right? But what we're trying to unpack here is getting into the psychology, right? So risk of delaying treatment for a crown with an open margin. So I'm having the AI essentially give me all the risks, right? Right here of delaying treatment, which you know of already. Decay under the crown, abscess or infection, crown loosening, tooth fracture, gum inflammation, recession, expensive treatment later, bad breath or taste. But the thing you have to ask yourself is this: how many of these am I even listing in my explanation to patients? That's a question you should be asking yourself. How many of these am I listing to patients? And how many of these am I reviewing with them casually in my conversation? And I think that's where you'll find one point of improvement, because you'll see many of us are not kind of going over this comprehensively with our patients. We're saying, hey, the crown's open, it's not sealed, and just between you and I, right? Stuff's getting underneath that's flowing in between the tooth and the crown, and it's making the tooth mush underneath the crown, and it could lead to a bigger cavity, which could lead to a root canal. Now, how many of you are going over the fact that, hey, you could, you could have gum recession around that tooth, or inflammation because of the lack of fit on the crown? What about bad breath or taste, right? So you could always figure out and be like, hey, interesting. I may not be talking about the infection or abscess formation aspect of it. And I may not show them a picture of a tooth that has an abscess because of a leaky or ill-fitting crown, because I just forget that in my sequence with them. So this is kind of good to help me kind of review, a lot of the negatives that could come with that, right? Now, this is not as important because most of you know this. It gets even more important when you're thinking about limiting beliefs, right? What have we always said? We've always said part of our role, just unshare my screen really quick, part of our role in discussing any treatment with anyone is busting through what? Limiting beliefs. Patients have limiting beliefs, and your job as a clinician or a leader or someone that is taking them to the next step is to help them dissolve those limiting beliefs, right? So as quick and as effectively as you can do that during your discourse with them, the better off it's going to be, the more likely they're going to take treatment. Because they may have a limiting belief that, hey, I'm supposed to do my kids' dental work, and my stuff can be on the back burner. Maybe that's a limiting belief. Maybe it's based on the fact that they can't afford it, but maybe you have a way that they could afford it, right? So these are beliefs that they are limiting the patient from moving forward. And your job is not so much to show them the possibility, but also, before you do that, is to dissolve the limiting belief. That's very, very key. If you don't dissolve limiting beliefs with the person in front of you, they're constantly going to think that they can't do it. And when people think they can't do something, they won't do it, right? So let's go back to my screen. So it gets even better now. How to say it to the patient? Well, you guys know how to speak to patients, but if you wanted some ideas, you could say, right now your crown has a small gap where bacteria can sneak in. I like that word sneak. I really do, okay? Because it's a mischievous word. It's kind of like a negative connotation to it, and it's something that people understand that they don't want, right? You might not feel anything yet, but it's like having a leaky roof. It's just a matter of time before it causes a lot more damage. The longer you wait, the higher the chances we'll need to do a root canal or remove the tooth. Okay, we know that part, right? So then, and it can give you a PDF download of all that stuff. Here's your visual download for your patients. You can download a PDF. Great, great, great. So the better thing happens is when you talk about limiting beliefs, okay? So we asked the same question here. What about if they're interested in clear aligners, but unsure? What are some negatives of them not starting treatment that I can tell them? Also, now look what I did with this prompt. Also include some limiting beliefs that they may have in getting this type of treatment done. This is where things get really interesting. This is where you have to really bake this into your conversation with patients. Limiting beliefs, right? So 2 parts. Anytime you prompt ChatGPT or any of these models, these AI models, on how to respond, ask them to also give you ways to address limiting beliefs. So this is how you supercharge your practical use of it. How can I bust through limiting beliefs? So we all know what happens if you don't start clear aligners. This is the dental part of us, right? This is the dentist in us that's going to tell us this. But common limiting beliefs, okay? I'm too old for braces or clear aligners, right? We've all heard of that. Many of our aligner patients are in their 30s, 40s, and even 60s. It's never too late to invest in your smile. Now, that sounds kind of canned, but a thing you could do there is you can ask them a question. Gosh, it's interesting you say that. Like, I'm curious, like, when is a good age to stop addressing your smile? What do you think is a good age to, like, not worry about your smile? You got to ask some of these exploratory questions to patients, right? When is a good age where you think you've got to stop worrying about your smile? That's a good question, right? Maybe it's too expensive. Now, this is giving me the outcome or the response, but we've also learned what are some questions to ask, right? So here's what I'm going to do. Common limiting beliefs you can address. I'm going to say this. I'm going to ask it for the clear aligner limiting beliefs. Clear aligner limiting beliefs. Can you give me some powerful questions to ask the patient that would help guide them to think past their limiting beliefs? Okay? For the clear aligner limiting beliefs, can you give me some powerful questions to ask the patients? Ask the patients that would help guide them to think past their limiting beliefs. This is good because we know that he or she who asks the right questions controls the conversation, right? So some powerful guiding questions. I'm too old for clear aligners. Here we go. If age wasn't a factor, what kind of smile would you want to have a year from now? Damn, that's a good one. That's a good one. I really like that one. If age wasn't a factor, God, what would you want your smile to look like? Now, what do? We get them to go from treatment limitations to treatment possibility. Right? Remember what I said? Remember, I said this. I said psychology. That's the part where most of us are missing this when it comes to prompting these AIs. And the AI knows it, but prompting it so that way we're also benefiting from the psychological aspect of this, right? So let's go through. What's stopping you from giving yourself permission to smile confidently at any age? I think that's a pretty canned response. I don't really love that one. I love the first one. It's too expensive. If you knew this investment would prevent bigger dental problems later, how would that change the way you see the cost? Okay, maybe we can clean that up and say, hey, what amount of investment would be worth it to you to make sure you have a smile that you're confident with? What kind of investment sounds comfortable to you so that way you had a smile that you're confident with? Because we have a lot of options in our office. We're asking the right questions to bust through the limitations, the limiting beliefs. What about it's just cosmetic? What would it feel like to not worry about how your teeth look? Ooh, I like that one. Ooh, I really like that one, guys. Or how they'll wear down over time. I like this first one. What would it feel like to not worry about how your teeth might look, how your teeth look? It's just cosmetic. Are you ever concerned with the way they look? Or I know I know you feel like it's cosmetic, but does the appearance of your smile ever concern you? You know, doc, not really, only in pictures, or sometimes I get a little self-conscious with it around new people. Now you're starting to explore and you're starting to unpack some of the psychological elements of it, right? I don't want the hassle or discomfort. What's harder, a few months of mild pressure or years of hiding your smile or dealing with dental wear? I don't really love that one. If this process was more comfortable than you expected, would you regret not starting sooner? Ooh, I love this one, guys. So look at this. If this process was more comfortable than you expected, would you regret not starting sooner? You know what's interesting, John? If this was a lot more comfortable than you anticipated, wouldn't you look back and think, man, I should have started this sooner? Okay, so that's a reply or a question that helps them think through, I don't want the hassle or discomfort. And you could preempt that reply by saying, I totally hear you on the hassle, because with braces, patients would come in because they would cut their lips, or they would lose their rubber bands, or they would get foods caught in their brackets. But we don't have to worry about that with clear aligners because you literally take them off to eat. So I'm curious, if you found out that this was so easy to wear, like, wouldn't you feel like, gosh, I should have done this earlier? How about this one? I'll do it later. What will be different 6 months from now that's holding you back today? Ooh, that's a good one. So this is a good one. This is, you guys, you have to get your patients to start dreaming and thinking in frames of possibility. So I'm curious, what do you think is going to be different in 6 months about your life or your schedule? That's holding you back today. What's going to be different from now that's holding you back today? And they may say, I don't know. I'm in my same job, or I don't know, doc, that's a good question. I guess I am ready. Maybe I've never thought about it. Do you see how asking the right questions to break through the limitations is the path to a better landing place, right? I'm not sure I need it. Well, this is the best response to that. Are you open to seeing what your smile could look like with a digital preview? Okay, I like that one. There's some here I like, some I don't, right? Because if someone says, I'm not sure I need it, I'm not going to be like, would you be interested in understanding how your bite might improve your long-term dental health? Yeah, I don't know. Because if they are saying stuff to you in the exam that was indicating that they were having issues with their bite, then yeah, I would probably ask that. Or if they were showing that, hey, you know what, I have a lot of wear around my teeth, yeah, I would probably ask that as well. But they're not saying those things. I wouldn't go there. I personally wouldn't go there unless I saw a tremendous need for that. But I think that, are you open to seeing what your smile could look like with a digital preview? I'm not sure I need it. And we reply back to that with a question. I'll do it later, and we reply back to that with a question. And you have your question here today. What's going to be different 6 months from now that's holding you back today? I don't want the hassle or discomfort, and you have a question in your library, in your deck of cards. Hey, you know what? A lot of patients are surprised with how comfortable this is because they're not cutting their lips. They don't have brackets. They don't have stuff that's getting caught in between their braces. And now they can take, they wear this, they take it off, and they do it on their own schedule, as long as they, wear it, 18 to 20 hours or whatever a day, and they're good. It's just cosmetic. I love this one. What would it feel like to not worry about how your teeth feel, how your teeth look? So you have a question to combat the limiting beliefs, right? Is it too expensive? I think we could do better here. Give me some better questions for is it too expensive? Or it's too expensive. Give me some better questions for it's too expensive. When a patient says it's too expensive, they're rarely just talking about money. They're weighing value versus cost and battling internal priorities. This is the part that I want everyone to really take note of. They're battling internal priorities. Here are powerful psychological driven questions to help them rethink the too expensive mindset and lead themselves to clarity. This is a good one. This is a reframe. We've talked about reframes, right, guys? We've talked about the fact that you take them where they're at, you have them reframe the perspective. Compared to what? Now, if you just come across and say that, it may sound a little flippant. So you have to kind of paraphrase some of this stuff. No, I hear you, but I'm curious, what are you comparing that to? This invites them to reflect. Is it expensive compared to a car payment, a vacation, the confidence they'd gain? You can follow up with, most people find that a smile they're proud of pays off every day. This is a good one. It's too expensive. What would it cost you emotionally if nothing changes? So if they need a full mouth case, but price is an issue, they're not ready yet, they want to get started, but they don't want to do the little thing or phase one, and there's 3 phases that you've dialed out. This is something that you can layer into the conversation during a treatment plan. And one thing, John, we always have to consider, or Susan, we have to consider these things. You have to ask yourself, what would it cost you emotionally if nothing changes? And I ask my patients that because they all carry the emotional baggage of wanting a better smile and not having it yet. I ask my patients that because they all carry the emotional baggage of wanting a better smile, but not having it yet. So I'm curious, when it comes to what you just said, what would it cost you emotionally if nothing changes? Now notice, I'm not saying if you don't do anything different or if you don't change. I'm saying if nothing changes. Because I don't want to pinpoint them. I don't want them to feel like I'm attacking them. I don't want them to feel like they are the culprit. I want to separate them from the situation. It's very key. If you can have your patient be the third eye and the situation be something that they look over, then they can see it in its full scope. They're like, oh, yeah, if nothing changes, here's could be it here. could be an issue. So you're guiding them to see the emotional and social toll of inaction. Confidence, self-esteem, job interviews, relationships, etc. Have you thought about what this could save you down the line, like future dental work or wear and tear? Okay. If this treatment gave you a smile you were truly proud of, what would that be worth to you 5 years from now? So you got to also know, is this person a future-paced individual, or are they like, hey, I want things done now, I want to feel good today? Are they short-term focused, or are they also looking at like, hey, I'm trying to be good for tomorrow as well? And for most people, it's a mix of both. And here's number 5. We've talked about this many times. If the price weren't the issue, would you want to do this? This is a key one. This isolates money from desire. If they say yes, now you can talk financing, breaking it into doable steps. Okay, so this is very important. If the price weren't the issue, would you want to do this? We've discussed this one. And the key element here is you are doing exactly what it's saying. It's severing or isolating the money from the desire. If the patient can say, yeah, I would, now you have positive psychological confirmation that they want to get it done. So it's isolating money from desire. It's making that 2 separate things. What would have to happen for this to feel like a worthwhile investment to you? Okay, so this helps them cover what they need to feel peace of mind. Maybe it's payment plans, results, guarantees, or just time. I love this one. And this is a great reframe. This challenges their frame in a respectful, empowering way. This one. Do you see this as a cost or an investment in yourself? You know, Doc, I think I see it as a cost. And then you can always ask them, hey, let me ask you, you seem like such a selfless individual, and you're always focused on helping others around you. I'm curious, when was the last time you focused on something for yourself? Do you see where I'm going with this? I'm not trying to push the treatment on them. I'm trying to ask deep, emotionally focused questions that unpack the psychology behind why they're thinking the way they're thinking. So that way they can reflect and they can come to that decision without me foisting it on them. That's where the win is. You guys feel that? Like, this is very powerful stuff. And what I've done is I've prompted the AI to give me the limiting beliefs, and then I've asked it to give me the questions that bust through those limiting beliefs. That's the thing. Limiting beliefs, right? The psychology is, give me, what are the limiting beliefs? And you always have to do this when you're asking about stuff like this. Limiting beliefs, because limiting beliefs, okay? And also the questions that break those beliefs. Okay? Questions that break those beliefs. This right here, you guys, is the win. This is the win. The person that asks the best questions wins. And using questions in the right tone. Oh, it's interesting. Like, what about this would make it worth it to you? You know, you could practice this, right? You can practice asking questions like this, right? What would have to happen for this to feel like a worthwhile investment to you? They'll tell you what they need. Versus what most clinicians do. You know, we have payment plans. Would you be interested in that? We have Friday appointments. Would you be interested in that? Oh, we can see you on a Saturday. Would that work? When you ask patients those questions, you're asking them to convert. Those are conversion questions. Like, yes, commit. Those are commitment questions. Yes, I want to come in on Saturday. Yes, I want to come in on Friday. Yes, I want a payment plan. It's too hard for them to commit when they're in the gray zone. So what you have to do is be in the zone with them so they feel understood. And the way to do that is to ask the right questions, because the question is the pass to the zone. So what would have to happen for this to feel like a worthwhile investment to you? That puts you right in the zone with them. If the price weren't the issue, would you want to do this? In fact, that's a question you all should be asking everyone once, if you ever get pushback, I'm sure you all do, on price. Right? That's a question you should ask everyone. Hey, if price were an issue, would you want to do this? It separates, and when you ask that question, what can you also do? You see 20 patients in a week, and you ask everybody that question, you can put them in what? 2 buckets. If price weren't an issue, would you want to do this? Yes, the desire is there. Patients, like 10 of these patients or 7 of the patients have the desire. 13 of them are so stuck on price, I couldn't crack that thinking, Ranesh. So 7 of them have the desire. They want to do it. They got the desire to do it. I'm going to put them in that bucket. Those 7, because they have the desire, I will now reach out to them in ways that heightens the desire and also heightens the belief that they can do it. Did you guys hear that? I will follow up with them in a manner that heightens the desire and also heightens the belief that they can do it. Because remember what we always said. We always say this. They have to know what it is. They have to know, is it for me? And they also have to feel, I can do it. What is this? Is it for me? Can I do it? What is it? Is it for me? Can I do it? Oh, I know it's clear aligners. So if Judy Lynn, who does incredible dentistry, I'm using her because she does some complex cases, but she simplifies it because she knows what she's doing. If she's doing an ortho restorative type case, or she's changing someone's profile, and they don't understand what this is, because they're thinking, oh, it's braces, it's Invisalign, I'm getting crowns. What am I doing, doc? If they don't know what it is, but they know it's for them, and they feel that they can do it, but they don't know what it is, that's a no-go. They won't do it. No conversion. So they got to know all 3. Those are 3. They have to hit all 3. What is it? Okay, Judy's great at explaining that. Okay, is it for me? Yes, they're going to get that when they go to her. And can I do it? Like, am I going to have to see you 5 times a week? Because that's a no-go. So you have to hit those, but you got questions now because you got the ammunition to hit those. So anytime you go into the prompt, and some of you are asking, ChatGPT, like some of you said, hey, I use it for explaining patients that, health history and dental risk associated with the medical conditions. And that's a very common use. Everybody uses it for that, and it's a great use of it. But from a psychological standpoint, I want you to sit down and just rap back and forth with this. When you have a few minutes, just get onto your phone and be like, hey, if a patient, and just think of a case you just had. I had a case that came in, they needed a snoring appliance, and they didn't get it done. They needed, an overdenture, and they opted in for the regular denture. What are some of the benefits you can, what are some of the reasons they should get it done? But then the next thing is going into the psychology, which is, what were the limiting beliefs around it? What were the limiting beliefs? And then what are the questions to break those beliefs? The questions to break the beliefs. And now as a clinician, when you speak with patients, you are going to be speaking in questions, not in statements. Because remember what we said, when you make a statement to somebody, you force them to believe you. Versus when you ask a question to a patient, you lead them to believe you. You lead them to believe you. Okay, it gets them thinking. It gets them thinking. In fact, we use the same psychology. if you've ever been on any of our free trainings or webinars, we'll teach and train for like 60 to 90 minutes. But before we hit the offer, what do? This is protocol. Before we hit the offer, we always ask 5 to 7 questions. How would your practice be different if you were able to incorporate porcelain veneers into your office? How would you feel as a clinician if you were the person that your community looked for cosmetic cases? Have you ever felt like you didn't know whether to do orthodontics or porcelain veneers or prepless veneers on a case? Have you ever been confused with that option before? Have you ever felt like you didn't know how much to prep or where to prep or what to prep? Do you see I'm asking questions? Because I'm sparking their thought process that is forcing them to reflect on some of their areas that they have problems with. So that way we can help them, right? People will never buy something that doesn't solve a problem, right? So questions do that. Questions are so powerful. And as you go through your discourse with patients, the thing is to ask the right questions with them, right? Not so much make the right statement, but to ask the right questions. Because all of you make the right statements. It's not that you don't do that. You all make the right statements. You know how to make the right statements. But asking the right questions is where it's at. And you'll see as you start to ask better questions, the patient will lead you to the case start. And really asking the question and pausing and having them talk through it and going from there. Just that simple question of, this one right here. This one right here. Isolating the money from the desire. If the price weren't the issue, would you want to do this? That just puts people in 2 different buckets in your office. And then I love the second one. What would have to happen for this to feel like a worthwhile investment for you? What would have to happen for us to start on this? What would have to happen for us to help you here with this tooth in the next month? What would have to happen? Well, doc, I drop the kids off every morning from 9 to 12. So I definitely would need a morning appointment. Great. You know that. It's easier to pay, 5 payments. Well, now you know that. So you're asking them questions that help them think in possibility, and they remove them from this place of thinking about, the treatment. Because possibility weighs less than reality, right? When you think about what's possible, the weight of that in our mind is usually less than the reality that's bogging us down, right? The possibility frees us, whereas reality is like, it's heavy on us. So if you can get your patients to start thinking in frames of possibility, they're going to be more open to making constructive, possible decisions. Okay? So what I'm doing here is asking for limiting beliefs and then asking for questions, right? And I can go through, let's see, and I can do the same thing with other treatments. Over here as an example, I did one with porcelain veneers, right? Limiting beliefs around veneers. Veneers are too expensive. I'm afraid they'll look fake. I don't want my teeth shaved down. I can just whiten my teeth instead. I'm too old for this kind of cosmetic stuff. I'm afraid of commitment or regret. Now, if you went into the room knowing what common limiting beliefs are for people around specific different types of treatment, and you knew what the common limiting beliefs are for overdentures, for porcelain veneers, for crowns, implants, endo, you just kind of knew, like, these are the limiting beliefs people have about endo. It could be that, hey, they think that by getting a tooth endodontically treated, that they are keeping a dead tooth in their mouth, and that is a holistic nightmare, and it's not something that they want to do. like if you know that this keeps coming up in your chairside conversations, then you're going to do your best to be like, I have an answer or a thought pattern or a sequence that breaks through that limiting belief, right? So I'm asking you to use the AI to give you the limiting beliefs so before you go into the room, you know what limiting beliefs most patients have, right? Cosmetic stuff, right? You know that, hey, I don't want my teeth shaved down. Maybe that's one of them, right? I'm afraid they'll look fake. This is a common one that we all have an easy time addressing because the porcelains are so much better today than they were before, right? The technology's better. So, I mean, how many of you say they're too expensive? I totally hear you, but you know, I'm curious if these lasted you for 20 to 30 years, would you think that that would be a great investment in your smile and appearance and the way you feel about your teeth? I'm curious. Remember what the other one was, expensive. I'm curious, what are you comparing that to? And I like that onboarding phrase. That's, I'm curious. Because it doesn't get patients to think of, you know, they're not offended by it, right? You don't want to offend anyone by having the perfect response right away to their hesitation. So this is one powerful way to use ChatGPT or even Grok, and I would stick the same thing into Grok. And what I'm going to do here, you guys, I think I can just email you guys. No, I can just do this. Here we go. I can share this with you. I don't know why this is happening. There we go. I can share this chat with all of you. Create link, copying. Okay, so I'm going to share this. So you guys, if you didn't take any notes on this, it's totally fine. You can look it up right here. This is a chat. So I just shared that chat with you. And I love what Judy said as well, which is money aside, is this something you want? Right? So these are smart questions, right? Because you're literally having them, you're moving them from thinking about the treatment to what's possible, right? What would it feel like to not worry about how your teeth look? If a patient says, I'm always a little concerned, you know, when I take pictures. If someone ever says that to you, the next thing you say isn't like, oh, I'm so sorry you feel that way, or like, God, oh, I know. Like you can add some of that in there, but you always have to land on what would it feel like to not worry about how your teeth look? That's a powerful question. What would it feel like to not worry about how your teeth look, right? And remember, what would have to happen for this to feel like a worthwhile investment to you? This is assuming something would have to happen, okay? Because something would have to happen. They'd have to start the treatment. If price weren't the issue, what would you want to do this, right? So look through these questions. These are great reframes, and reframing objections is a powerful way to shift patients into thinking about possibility. In fact, I will say, if people are always stuck in this land, they're stuck in this land that, you know, after you presented the treatment, they are in treatment plan land, right? They're in treatment plan land. Treatment, I don't know why I wrote that out. I should have said TX. Treatment plan land, they're there. And many of your patients are stuck there. And that's why they don't get treatment done, because they're sitting here. And if you could just move them to this land, the land of possibility, oh, they will get things done. They will start things. And the bridge to possibility starts with the right questions. Okay? The bridge to possibility starts with the right questions. This is everything. If you keep your patients stuck in treatment plan land, then it's a transactional deal. But if you put them into possibility, and how do you do that? The follow-up can include, hey, John, I thought of you. We just finished up an amazing case that reminded me of your front teeth. Check this out. Boom. They're thinking, man, this is possible for me too. This is possible. This is more than possible. So they start thinking this way, and then bam, they're in a different place. From that place, they can make better decisions. They're not held back by limitations. Okay? And the bridge is your questions. Guys, so that's how I want you to use ChatGPT to explain treatment.